I hope all of you had a happy Thanksgiving last week. We're turning the final corner here, getting ready for finals. This is week 15, and this is our second week and final week where we're going to be focusing on how healthcare impacts disparities. This week, I have just a few readings up that try to talk about interventions. How can we help provide better healthcare to people, or how can we make healthcare that we have more effective? So that's the focus of the readings that you have this week. What I would like for you all to do too, make sure that you get on the discussion board and do 2 posts for your colleagues, just to give them some feedback on what they posted last week. And then your bigger assignment this week is to really think about the topic that you're focusing on in terms of how healthcare might be contributing to it. So this is focusing on downstream once everything else has been set in motion and you've got the patient who's now entering into the healthcare system with a problem. How might that healthcare system be increasing the health disparity or decreasing the health disparity, decreasing the progression of that disease? So for example, let me give you an example. Let's just say it's breast cancer. And clearly there are a lot of upstream factors that have contributed to the woman being there with breast cancer. But once the person, let's just say, gets the mammogram, there's a progression set in motion. So was that mammogram, what was the quality of the mammogram? Was it a really high quality digital mammogram where the disease was caught early? If it was abnormal, what happened? How did that patient then get to the next step to go see the radiation oncologist or the surgeon? You know, was that something that there was a patient navigator, for example, to help the patient hook up? Or was the patient, did they get referred to another system that was new that might have been very frightening for them? Or did they stay within the system? There's all sorts of factors there. Once, if it's cancer, in many cancers, the rate at which they move along the necessary medical steps can make a big impact on how the health outcomes are. Were all the choices offered to that patient? Maybe they weren't offered all the treatment options. And so what's coming in there? What's contributing there? So those are the kind of things that I want you to think about this week. With this assignment this week, I also want to highlight for you that that can be a piece of your final paper. For those of you who have healthcare that is relevant to your disease topic, which most of you should, you know, that would be a portion of the paper, as you all know, because you've read the directions on what's supposed to be in your paper, okay? If you have questions on that, give me a call, email me. Just a little reminder, the final paper is due Wednesday, December 11th by midnight. If you're going to be late, let me know. You've had a lot of advance notice on this, so hopefully you've got all your questions clarified. But again, please don't hesitate to contact me. The details on that are in your course materials. It's 8 to 12 pages, and this will be the last video. I hope you all had a nice time getting to know each other in this course, and that you learned some things that are valuable. I appreciate all your hard work. Thanks.